Hello, I'm Lathrop Woodard, Chair of the Board of Directors of the National Association of Community Health Centers. As most of you know, this year's 2020 Policies and Issues Forum was canceled due to the growing concerns about the spread of the coronavirus, COVID-19. I want you to know that we did not take the decision to cancel the conference lightly. The health and wellness of our communities, patients, staff, and boards was our top priority. We also recognize that as frontline responders to today's rapidly growing public health crisis, health center staff needed to be where they are needed most, at home in their communities, helping to contain COVID-19. NACHC staff is working together as a team with PCAs, HCCNs, federal agencies, and critical partners, including foundations and corporations, to do everything we can to support you. While we could not be together in Washington, D.C., we can, however, move forward on the other critical issues we face. I am therefore speaking to you today, along with Tom and Steve and members of the policy staff, to outline our priorities and urgent actions needed in the field. In addition, Dr. Ron Yee and members of his clinical staff, along with Jason Patnash, and key staff from HRSA and CDC will conduct weekly conference calls and webinars to include updates and Q&A opportunities for all health centers. Yes, I know you're probably participating in a lot of conference calls at your state and even local levels, but we thought it was needed that at the national level, we have HRSA involved and we talk specifically about the issues FQHCs face in addressing this crisis. And now, the plan for our national priorities. As a result of the NACHC 2020 Winter Strategy meeting earlier this year that brought together over 200 health centers, primary care association, and health center control leadership, and our external experts, we now have a framework for the year ahead around the strategic priorities approved by the NACHC board. The strategic goals focus both on the challenges we face today and also what we as community health providers need long term. In summary, these include ensure our sustainability, strengthen capacity, secure our place in a changing and challenging healthcare environment. The specific objectives include first, seek and obtain resources to both stabilize our current operating programs and seek additional resources such as funds to address public health crisis, whether it's today's COVID-19 or tomorrow's hurricanes, floods, tornadoes. Second, secure funding that supports development and retention of an adequate workforce now and in the future, including doctors, nurses, dentists, behavioral health specialists, as well as administrative and IT staff. And last, seek and obtain funding to support innovative models and systems of care that position health centers as leaders in healthcare finance and service delivery. There's much to be done. As we have learned from years of experience, it means collaboration, teamwork, and advocacy, working together at state, regional, and national levels to maximize our imprint and collective leadership in the nation's health system. Now, before I turn it over to Tom and Steve to provide more information about our legislative priorities, challenges, and strategies, I want to stress to all of you not to forget to educate and keep your non-clinical staff updated on the facts and prevention protocols around COVID-19. Outreach staff and our board members can be assets in calming the community panic of the not knowing or not receiving accurate information. How we have supported each other in the past through multiple hurricanes, floods, and tornadoes, that same support will get us through COVID-19. Now, let's hear from Tom and Steve.
Lathrop, thank you very much, and for all of your leadership, that along with our officers and board of directors, you have been incredible. We know and we understand at the NACHC staff level, we've talked to so many people, what it is that our people are going through on the front lines, each of you. And just, I want everybody to understand that we all are here for you and the people that we're serving, and we operate as one team, whether that's NAC, whether it's our PCAs, our networks, HCCNs, or work with the government. We're here to unify and to help each and every one of you. Lathrun, you had mentioned, again, the three major priorities for the organization. Consistent with those priorities, we are accelerating the plan that has been discussed from our leadership committee meeting recently and a meeting from our PCA HCCN conference. And so toward that end, I would first like to talk to Ron. Dr. Yee, you've been doing an incredible job with your staff and others. Would you tell us and address some of the issues, please, for the front line in our strategy moving forward?
Sure, Tom. And I think we all want to emphasize we're behind the health center field. Our thoughts and prayers go with our staff who have been on the front lines tirelessly, our patients and our communities. So first of all, I think it's important for them to know we're behind them 100%. I think we know how to do this. Health centers know how to do this. We have been through fires, floods, hurricanes, Ebola, Zika. Okay, health centers know how to do this, and I think we just need to align our efforts and learn from each other. So that is the advantage we have in the health center field, is we know how to do these things. So I think our goal is to really create that platform to be able to do that and to use our resources with the Bureau of Primary Healthcare and HRSA, input from the CDC, and then consolidate that down. So there's three areas I really think we need to really focus on, and this will really help us a lot, is prevention, identification, and then to contain. So those are terms used by the CDC and others, but I think it's really important. So in terms of prevention, we really need to take care of our staff, okay? My challenge to the staff is really to stay healthy and stay on the front lines. We need you at this time. We need to think about our families, of course, and we will work with each health center to do that and our staff here at NAC. But you need to really be on the front lines and use your PPE, your personal protective equipment correctly, okay? Many health centers have shifted into areas where they're concentrating the people that they're unsure about. So they're keeping their well patients separate, well child checks, chronic care patients that don't have these issues. So if you can, as much as possible, I've heard of health centers either having people in a tent that they're worried about, even seeing them outside of the organization, or shifting to more telephonic means. One health center actually is using Skype, and the patient comes in and checks in, so they don't even have any exposure, and they can sort those people out. So I think if you can do a good prevention mode, you'll save your staff, you'll save your PPE, and you'll work with the right patients. So I think it's really important to do that. Number two, identification. So you heard on the news in this last week, and I think at least 7 states are rolling out drive-up testing. Okay, we have to work through those details, and we need to hear from the health centers. They're our eyes and ears out in the field. If they have examples of how to really do this, and the public-private commercial laboratories are jumping into this, LabCorp and Quest are the first ones, we need to know that these tests are actually being done in the field. All the way to being able to get it into the electronic health record with the right codes. We need to know that the samples are getting there. We need to know about the turnaround time. And then finally, we get the results back so we can tell our patients. And the ultimate step in the whole cycle is getting paid for it and reimbursed so we can keep the doors open. So we need to hear from the field about that. So I think that's really key. The identification piece is critical in this. We're going to see a jump. Don't be alarmed. We're going to see more cases because the testing is being done. We need to keep our heads and stay focused on that. So that's identification. And finally, containment. Once we get those results back, we need to work with our communities and patients to figure out how do we best isolate them and stay in contact with them. Tell them to stay home. If you're sick, and you're an employee, you stay home. If your patients fall into that category of somebody under investigation, person under investigation, they need to be quarantined. But we also need to stay in contact with them so they don't lose faith in what we're doing. They feel confident that we're with them. So we need to do that. We need to figure out how to handle our employees and then contain this and work with the public health department locally, the CDC, and others that are really controlling this and looking at it. So I think if we can do those 3 things, we can do the prevention, we can do identification, and then containment, we can help get this thing under control. So NAC is going to have a series of updates. So we are going to start with a weekly basis, and it could turn into every couple days if we need to, depending on how fast this develops. But we were going to have HRSA, the Bureau of Primary Healthcare, on these calls, the CDC, I think the EMAC, the Emergency Management Advisory Coalition, which works with all of the PCAs, and Tina Wright's been doing this for a decade. That's our connection to the field, as well as health centers that have figured these things out. So those are who we want to be on the updates. We will do that. If you can't make it and you're a clinician, we're going to have the recording and we're going to have the transcript. So whatever fits their schedule the best so they can get the information, we're going to do that. And finally, we also have the preparedness at NACHC.com website, so preparedness@nac.org, to let us know what's going on in the field. So you are eyes and ears out there, the people in the health centers and the PCAs, so that we can move forward and share with each other. That is a critical piece. When we find out how to do testing, whether that be drive-up testing or whatever, we need to hear about that. If anybody develops a new protocol or a innovative way to take care of patients so that you're not exposed, let us know. So we will continue moving forward, and I think we can do this. I know we can do this. We've done it before with other situations, so I'm confident we will come through. And I think Mike wants to share some things with us, who's our chair-elect for the NAC board.
Well, thank you, Ron. Even in sparsely populated northern Minnesota, we're not immune from the virus. We had just received word that our first 2 confirmed cases are within 45 miles of one of our health center sites. So isolation and distance is not protection for a health center. And so we all have to be prepared to deal with the virus. Certainly we're seeing now, and we're doing advanced screening with our patients that are coming in to see our clinic providers. We're doing pre-visit phone calls, contacts with them to make sure that they don't meet any of the initial indicators of potential virus exposure. And that's adding some workloads to our reception and nursing staff just to make sure that we are cautious in what we're doing. We're currently looking at potential lockdown or restriction on numbers of visitors that come with patients to the emergency room to try and limit access in our waiting rooms. To try and limit the exposure to some of our chronic care patients. And we're looking now also at deferring some preventive visits, some annual physicals where they may not be needed at this time, and we'll try and reschedule them once we get through this initial virus wave that seems to be building. Part of the discussion also is use of PPE, personal protective equipment, where we need to have masks, where we need gowns, where we need gloves. If we need extra PPE in certain areas where we don't necessarily use PPE, we're looking at conservation of use of N95s because there are limited supplies of certain types of PPE. And so where do we get the best usage of those limited supplies of PPE? And we're planning for a slowdown in availability of PPE. We're starting to see some allocations from all our vendors about when we order PPE. There are just restrictions on availability of masks, gloves, and gowns, the things that you would expect to use in a more contagious environment. And so we have to account for that as an issue and start planning for how we replenish those PPE stocks. So the virus is here, and we're doing the best to keep our staff safe, keep our patients safe, because we don't want to spread contamination to our patients. We have some employees returning from vacation. And so we're having conversations right now whether they go into a mandatory quarantine before they come back to work, because they may have been traveling through airports that have exposures to coronavirus. So that's currently what we're doing. We expect that we will see more positive cases, and we will have to deal with them accordingly.
Mike, contained in this letter is a $44 billion request that is based on the reports that we received from you and your colleagues across the country. Contained in that request is a $22 billion cliff fix, $4 billion expansion of 10 million patients, 7.5 for infrastructure and IT, $5 billion for workforce, and then a $1 billion emergency fund to prevent these kinds of activities from occurring again, so we don't have to go back to Congress again and again. The key is, from our perspective, NAC has heard you. We know that there are challenges that you face on supply and surge, but through the many meetings that Tom and I have had with the membership, the auto HIPSA challenges and so forth, this request to Capitol Hill should resolve part of that.
A good part of it, Steve.
A good part of it. We still have our requests in on the appropriations for the fiscal year 21 cycle. We understand that you are on the front lines. We acknowledge that. We do hope that if you are not on the front lines at this moment, that you can still reach out to your lawmaker and make the case that we have to have these funding cliffs fixed. I'd like to draw your attention to the Washington Post article that took place last week, and it was that article that led the administration and the staff at Health and Human Services to re-engage this cliff fix. And we are using this as an example for you on the front lines to engage your local lawmakers and local media.
Steve, I want to thank you for that, and we'll get into the positions just a little bit more. But first and foremost, I want to say thank you just to everybody. I know the entire staff's been working into the evenings and over the weekends, as I'm sure so many of you have. Ron, again, I think what Steve mentioned, the public appearances you've done on radio and on television and getting the message across has led to a number of national articles that Claudia and her staff are working at, talking about what role health centers can and are playing, not only with the current corona situation, but also building that infrastructure from the health center program for the future. And I think, for example, when you look at the Washington Post article, and it said, Steve, the Health 202, here's a simple way for Congress to fight the coronavirus. Fund community health centers. That's the Washington Post. Ron, I think you did an incredible job, went on television, of both explaining the need for the cliff, which is that short, and if that runs out, where the heck are we?
Right.
And then secondarily, what more is needed for us to successfully, Steve, have that discussion. Madam Chair, and to everybody here in our membership, I want to explain, I was sorry we had to cancel the Policy and Issues Forum. That was a very significant financial hit for the organization. But let me be clear, our unanimous decision, the board, the executive committee, was protecting you, our members, our frontline providers of healthcare, who are in turn seeing the patients in our communities. That was the first concern, and the only concern that was considered in making a unanimous decision. Number one, I would like just everybody to know, consistent with the plan, Mike, that the executive committee, Lathrun, and all of you, we have been very aggressively moving on forward with that. When we say federal officials, Steve, and I want to commend you and the policy staff, along with Ron and clinical staff and our entire staff, we've been meeting with the Office of the President. We've been meeting with the Office of Management and Budget. We've been meeting with key congressional leadership. Here on the proposal Steve briefly ran through for each of you, not just to fix the cliff currently, but to provide additional funding for the current coronavirus, but also to build and address the key issues going forward. First and foremost, workforce. The proposal that you've included, Steve, and as I understand it, as I've read it, not only talks about the doctors and nurses, the government itself, which projects major shortfalls in both the fields of physicians and nurses, and doesn't even address the corona or other situations or behavioral health. So the proposal you have looks at both the doctors, the nurses, other staff that is required for a behavioral health area, for example, other areas, the opioid, again, situation, dental health, oral health, et cetera. So the broad range of comprehensive health services, making sure they're available to people on a much larger basis. You've included expanding funding to at least 10 million additional people. And I think most importantly, you've included the two items that the members said they needed help with. One is flexible funding, and the other is under the infrastructure and IT. Steve, which again, so I encourage everybody to take a look at those pieces that have been carefully crafted and again have been raised by the committees, the leadership. I think you've done a great job of putting a significant package together. We will be meeting, so in addition to that, with key people on Capitol Hill, I think this afternoon we're set to talk with Speaker Pelosi and her staff, and I know Senator Dash will offer to help with Senator Schumer at the very top of the food chain. But every member of Congress is who you've contacted, and that's the way it needs to be, Steve, in every congressional district. So what's going to make this real, my friends, is you telling that story and telling it back home and what the impact is. I commend Michael, you and Jonathan, your state association director, for producing documents like these. What's the impact? What's the body count? How many people are being affected? What services are you provided? And then dollar estimates like these. If we had this for each and every state, Steve, it goes a long way for you making the case back home and us making the case here on your behalf. We need your help. We're all part of the team, folks. And so I say thank you for that. We've talked about the membership. Again, we had a meeting with the PCA Leadership Committee this morning, and we'll be meeting with them probably 2 or 3 times a week to make sure we stay tightly coordinated. Ron, it should not go unnoticed that the discussions you've been having have been both with CDC, and I mean from the very highest levels up to the middle, is in the close work which CDC, the Centers for Disease Control, appreciates the strong input and participation and daily contact you have with that organization and ways in which they can be helpful. But also coordinated tightly with the Bureau of Primary Health Care, Jim McRae and his staff, and Dr. Padilla in the Bureau of Health Professions and his staff, and what we, NAC and the PCAs, working with you centers, can do to better estimate and gauge the need for our workforce in specific numbers, where you need help, what kind of help you need. So we build the infrastructure, the IT system, Steve, everything that you were talking about, the other kinds of infrastructure needs, and flexible funding to deal today with coronas and looking forward for additional areas that are going to need increased investment. But letting that ingenuity come from what is needed in each community locally. The rural areas may be one of the easiest spots to see, Michael, as you well know, with a service area the size of yours. But we also have urban areas. But within that, it's the telehealth, it's the internet connection, it's all of the other pieces and staffing that we have to address. So, Steve, I don't know if there's more on the legislative proposal. Our order is let's get that out to all of our members so that you can get the help you need, both from your local and state elected officials, but also into Washington. I might add, Steve, that in addition to the groups we mentioned here, you've worked with the National Governors Association, and you've been working with the staff there to make sure this issue is high on theirs. Likewise, the Council of State Legislators and a number of other organizations, the Bipartisan Policy Commission. So it's important to know that we're striking out on virtually every front, as you are, to make sure that each and every one of you have the support that you need going forward. I would like to ask just a couple of questions, if the panelists here would not mind. Ron, let me start with you and then maybe getting from Mike a sense. But what more is it that we can and we need to be doing and focus on that we didn't discuss so far?
Sure. I think one important point is how critical the health centers are on the front lines to be the first responders in these situations. We are the answer to keeping those numbers down in the emergency room in the hospitals, because that's where the system is getting stressed so bad. So we need to stay on the front lines, and it's a challenge because we're going to run into issues we've never had before. H1N1 in 2009 was never this big, and so we're going to have this cycling staff, which is going to be a challenge because people are going to be exposed. They may even have positive tests, and they're going to need to be isolated for 14 days. So we're going to have to figure out how to work with that staff-wise. We've not had to deal with that before. So we're going to have this rotating thing. I don't know if we find locum tenens, other people in the community to help out. But that's going to be a big challenge for us on the front lines. So we need to do that purpose, and I think that's really critical for each community to keep people out of the emergency room and hospital. But logistically and operationally, we're going to have to figure out what that looks like. When you have people rotating every 2 weeks, that's going to be tough. So we need to deal with that.
Michael, do you have a comment or two related to that?
Staffing is going to be a challenge, and it's going to affect each health center differently depending on how many of their staff may be subject to isolation or quarantine, how many patients are appearing within the clinics, and how rapidly the coronavirus spreads. One of the challenges for all of us is to try and flatten the curve of the impact of coronavirus. The more time we have to deal with the issue, the better the response can be. But if it spirals out of control, that's when we run the risk of the health system crashing. And whether it's the health centers crashing or the hospitals crashing, we need to be able to lessen the immediate impact and spread it out over time so that we can continue to provide care for our patients.
Thank you, Michael. And Steve, let me ask you a question. What can folks do? I get that question all the time. We talked about the data and making a case. And I think, when I hear you, Ron, talking about the emergency room system crashing, and I think that is a big concern for a lot of people, let alone its availability, is a big issue that helps us sell, if you will, this proposal, a $44 billion proposal that we're putting on the table. Let me ask you just, Steve, what could we do? What do you need to make that case? And what else did we not discuss that we could be doing as we have to make a very strong case over the next few weeks?
Well, the beauty of the Health Center Movement program is that we have a case to be made and everybody knows it. But our backs are to the wall, and that is why this data that Mike produced and his colleagues in Minnesota, they make the case for why we need this $44 billion program. It should not be needed. This letter should not be needed right now, but that's where we are. We need a $22 billion reauthorization, and it's been extended numerous times. If it hadn't been extended, we possibly wouldn't have the staff shortages that we are now going through. Please pass on your data. We then can take that data and your anecdotes that we are gathering since the past 2 weeks, and we're conveying them to Capitol Hill. I would also ask, Tom, that you have got to reach out to your local press. The lawmakers pay attention to the press, and that is one of the first things that they will read every morning. It's one of the last things they'll read every night. Please be active. As you're on the front lines, we recognize there are a lot of challenges, but we need the funding to accomplish this job.
And Steve, are there other folks that you suggest that we be talking to? I know that you'd mentioned, for example, locally.
Great point, Tom. Since you're on the front lines, you have board members. You also have community leaders. Engage them. Engage your board leaders. Engage those employers. Engage the bankers. Look, this is an all-hands-on-deck effort. You are a community leader as well. Engage the board leaders to reach out to members of Congress. If you can't reach the members of Congress directly, reach out to their staff, both the House and Senate staff. This is an all-hands-on-deck effort.
And again, Steve, let me just reiterate that this $44 billion proposal, which includes fixing the current, quote, funding cliff reauthorization, as well as new money. And I think it's important to understand that additional funding, Michael, to the issue you and Ron had raised, does allow for flexible money for HRSA to make grants to help with temporary staffing, to hire new and additional people, and to be, as well as working on teaching health centers and a series of other programs to continue that trend for the longer haul.
That's a great point, Tom, and I would like to add that the administration's initial $2.5 billion request did not include funding for the Community Health Center program. NAC engaged lawmakers to include that $100 million that's now in process that should be out the door within the next couple of weeks.
The down payment?
The down payment, Tom, and we are going to ask for another $320 million, hopefully to be injected following that $100 million in addition to that $1 billion flex account.
Mike, I might add, when we were looking over the numbers, for example, you provided here, why we're asking for a much bigger number, and these numbers were not, when I say $44 billion, when you look at the letter, it's broken down into the 4 components that Steve talked about. It's not just picking numbers from the wall. This was following discussions we had with HRSA, asking a good interrogation, a set of questions, as well as what we've received from our primary care associations and what we've received from individual health centers that have helped us make very good estimates about what is needed for this situation. So it's a well put together document. It's not just picking numbers, but to be critical and to be credible, again, going forward, it's imperative that we have the data, and I commend our state associations, those who are already working aggressively and on a fast-track basis, both to get the numbers, Steve, and to start lining up the additional kinds of appointments, as well as the relationships, Ron, with whoever for additional personnel to try and get stand-in and other people who can help fill in.
Sure.
Michael, anything in closing?
I just want to thank you for all the things that you're doing on behalf of the health centers. And I think at this point in time, America needs health centers more than they ever have before.
Touche. Well stated. We're there for you. We're there with you. And to just know if there's anything, do not hesitate ever to let us know how we can better help. Thank you.